Okay, so I'm trying out my new gimbal for making videos so I can share and document this experience with y'all since y'all can't be here. So it took me literally 10 minutes to turn the damn thing on this morning, so there's going to be some touch and go moments, but I will give you my very best. This is obviously my wig, and probably will be the last time I'd be videotaping with it on, because as you guys all know, I get pretty sick for the next couple of weeks, and the last thing I'm doing is worrying about my wig. This new mask, I hope you all find fabulous. It's by Lauren Mashi if you're interested, but they might be out of those by now, but laurenmashi.com, shout out. I'm gonna flip this around and just show you I think I can flip it around. My daughter's laughing at me right now. I cannot flip it around. I was gonna show y'all this is what my chemo suite, quote unquote, and I use that word lightly, looks like. So it's kind of nice to have private rooms. There's a Jack and Jill bathroom that you only have to share with one other patient, so that's nice. Even before COVID, that was nice, but especially nice now because, as everyone knows, we can't allow loved ones in here, so it's just myself and one other patient that is using the restroom at any given time. So when you first get to chemo, they take your blood work and test to make sure that your white blood cells, potassium, so on and so forth, are all okay in terms of chemo and cancer, to make sure that it's okay to proceed with the infusion today. So I just had that. So I'm waiting to get those results back. One thing I forgot to put in my Caring Bridge update yesterday was my potassium has been pretty low, which was one of the reasons why I was so tired. So now I'm taking potassium 2 times a day, and that's back up, and I can feel a difference, and I feel better about that. So just waiting to get those numbers. When those numbers come back from the lab, my oncologist, Dr. Lerner, will then come in, and we'll talk about treatment. We kind of go back and forth about whether or not we should be changing the protocol for lots of different reasons, one being the symptoms. I fight pretty hard to just get these done as fast as I can, so I don't want to change anything. So we'll see if I get my way today or not. She'll come in, sometimes she's here, we talk for up to an hour sometimes about symptoms and things that have been going on and how we want to change things around. And then we start with the pre-medications that we need to take before we start with the chemo. And the pre-meds take about, IV pre-meds take about an hour and a half. They're just some fluids, a whole liter of anti-nausea medications, and then Decadron, I think. Decadron is the steroids that they give me, and that takes about, that bag takes maybe 30 minutes. So it's about an hour and a half of different things just to get you ready. So to start, the steroid also is preemptively given to help with nausea and help preventing nausea. So once I speak with Dr. Lerner, then she puts in the orders for my chemotherapy regimen. Then we start with the pre-meds. The chemotherapy and immunotherapy drugs, then those orders are sent down to the pharmacists, and they actually mix them, and then so they're fresh. And then that goes to another pharmacist. That pharmacist double checks and makes sure everything is okay and that things were mixed properly and the doses and things are fine. That process takes about another 45 minutes. And then those are delivered here, and then the nurse comes in after all of the pre-meds are given, and they start those one at a time. You start with the Herceptin, which is the immunotherapy drug that's meant to target just my HER2 positive status of the aggressive side of my cancer. And then the last two are the demons, and those are the actual chemotherapy drugs. One is Taxotere. That's the one that causes the skin in my mouth to fall off and the fluid to accumulate on my heart and my lungs. And then the next one I think is called Decadon or something. Oh, no, it's not that. It's not that. I'll find out. I'll get back to you. So the Herceptin takes about 45 minutes, and then they change that bag out, and then they'll give me the Taxotere, and that takes about half an hour to an hour, and then they'll come back in and they'll give me that last one. I don't remember the name. I always forget it. And that one takes maybe only a half an hour. And then I'm done. So I will take some videos of all of those things as they happen and try to edit all this so it's not a 7.5 hour video for you all to enjoy.
Hi, buddy. Hi, Fritzy. Hi. Hi. Oh, hi, Fritz. Oh. Oh, you can't come in, buddy.
Okay.
Got it?
Yep.
Good. You hold that back down. Okay.
Yep.
All right. You take a breath in, hold, and poke. Boom. Done. Keep holding that, okay? I've got to put your dressing on.
Perfect. So that's just poked in through my port. Handy dandy. Oh, okay.
I never realized, that's what was going
Right.
on all the time.
Right.
Now I know, and I feel like a dope.
Is that the Herceptin?
This
No,
right,
or the
just normal saline to get this cap on you, so it's primed and ready to go. I will connect you to your saline line so I can give you your Emend and your Aloxi pre-meds. The little one is just another kind of a river to
help it
plug
to.
each of the chemos into.
Okay, so the Herceptin, which is the immunotherapy drug, is now starting. This is the one that I have the anaphylactic reaction to. So the first dose of Benadryl usually covers that, but so I'm really getting sleepy. But I try to stay awake for the half hour that it takes for this one to be administered. In case I start having some itching and my throat starts to do what it did, where it starts to swell up. I don't want to be sleeping when that goes down, so I'm going to try to stay awake for the next, 23 minutes, in case that starts to happen, and then I need another dose of Benadryl. And if that happens, I will for sure be out for the rest of the day sleeping. So if that does happen, I will let y'all know, because you won't be getting any more video today, because I'll be snoozing. Hello. So I had another anaphylactic reaction to one of the drugs. So they just had to give me quite a bit of Benadryl IV. And so I'm going to be sleeping and maybe fall asleep with this camera still on me, because my eyes are so heavy. I may not be able to record anymore today because of how sleepy I am, but I'll be sure to record all of my appointments or portions as much as I can moving forward, so everyone can see what this process is all about and what it entails. So getting more Benadryl and then getting I don't remember, some strong steroid that is supposed to help with my reaction. So over and out. Good night.